name is Natalie Goedeker. I'm a nurse practitioner at Washington University School of Medicine in St. Louis, Missouri, and my project was in collaboration with a couple sites in the U.S. looking at early treated infants with spinal muscular atrophy, specifically initially treated with Risdiplam or Risdi. The purpose of that is that we can potentially treat them a little bit faster with that medication. So we wanted to see if treating them faster, meaning instead of treating them at 4 to 6 weeks of age with nusinersen or omnisemnogene, which is a gene therapy product, because we have to wait for the insurance pathways and for labs and other workup, if we treat them at 10 days of age or 2 weeks of age, can we improve their outcome? The first prong of this project actually was just published in Muscle and Nerve online this week and was looking at the outcomes of the babies treated with those other two medicines that I mentioned by 6 weeks of life. And we know that the babies with 2 copies of SMN2, who most likely would have SMA type 1 if we waited to see, 25% of them won't walk at all. Of those who walk, only about half walk on time. Now they're living, they're alive. The majority of them are without any respiratory requirement or feeding requirement, but some do require those things. And so we're not perfectly treating them, and we think that it's in all likelihood due to the need for the SMN protein prenatally and in those first 6 weeks or so of life before we can get them nusinersen or omnisemnogene. And so the babies that walk but don't walk on time, you may wonder why that matters, and it matters because they're weak. Things are going to be hard for them. They fatigue, they can't walk around school, around the community. Things in life become hard for them, especially as they get older and they get bigger. So now this project, we just are presenting interim data here to see, especially in those 2-copy babies, if we can impact their outcome by treating with Risdiplam, even if it's just a bridge for the first 4 weeks until we can get them another therapy. Results are interim, so I don't feel like we're far enough along to say that there's quite an impact. So far, all of the babies with 3 or 4 copies of SMN2 are developing on time, so just like their peers without SMA. Those with 2 copies of SMN2, it is variable. We have, of those who are of age to walk, so far all of them are walking by 18 months, which is within the realm of normal, or the range of normal. But we do have some that we suspect are going to have some motor delays, just based on how they're looking early on. But we're not quite far enough along. I'd say in about 6 months or so, we'll have some real good data to be able to tell if this is making an impact. I wish that there, perhaps in the world of primary care, there was more prompt referral for a young child with weakness, not necessarily SMA. In the US, we have newborn screening, and so the babies do get promptly referred because of that. But in general, a young child with weakness, the tendency is to refer to a physical therapist first, which can be okay in some circumstances, but in general, I think that we delay diagnosis for some children with neuromuscular disease because of a delayed referral.